Hey everyone, this is Daniela from the Obstacle Doc, and today we're talking about reasons that we might have a difficult time getting into a front rack position. There are 5 main things that we're going to look for when it comes to getting into that front rack position. The first is going to be your shoulders external rotation. Your second thing is going to be your latissimus dorsi or lat tightness tension. The third is going to be the amount of thoracic extension or kyphotic posturing that we're in. Your fourth is going to be the amount of wrist extension that you have. And the fifth is going to be your motor control. External rotation in the shoulder is one of the limiting factors for your front rack position. That looks like external rotation here and here. It's also how well you can get your hand behind your head. So if you are having difficulty getting out either evenly from side to side or in general coming out of neutral, you are not going to be able to pull the elbows underneath you to get yourself up and lifted into that position. The second thing that can really limit somebody's ability to get into the front rack position is going to be the tension or tightness of their latissimus or their lats on their spine. So our lats, if this is our right shoulder, our lat connects right here on the front or medial side of that humeral head. And so it is coming all the way down from your low back up on the side of your flank, if you will, into that position. So if there's any tightness holding you down that you might have identified in a floor angel, snow angel from one of our other videos, you are not going to be able to get into as much overhead extension, and therefore you're going to have a rate limiting factor on coming up into this position because we are pulling on that structure as you're lifting the arm up. The big thing that we can find is going to limit somebody into front rack position is going to be the amount of thoracic extension they have or how much flexion they are forced into. So as we talked about in our thoracic extension video, if you are finding yourself in a really kyphotic posture, you're having a lot of difficulty holding yourself in that tall, ideal position, you are going to have a harder time lifting your arm up into flexion just because of the curvature of the spine. So if we can break into more extension or at least into neutral, now we're going to have more degrees of freedom to come up and underneath us. The fourth thing that we're going to look for is our wrist extension and range of motion. So if we are going to be in our front rack position, we have to make sure that we have the ability to pull our wrists back in space and hold them there. If we're having any difficulty doing that, we need to understand if it is a matter of joint stiffness. So if there's any reason that we cannot play with the joint in that direction, or is there a lot of tension on our forearms that are holding us in that maybe neutral and flexed position. So last but definitely not least is our motor control. If we have the degrees of freedom in our shoulder, we have a good degree of mobility in our lats, our thoracic spine is nicely held in extension, and we have good wrist movement, we should be able to get into that front rack position fairly easily. The problem comes when we start to load it. If we don't have motor control through our shoulder girdle, through our wrists, through our elbows, as soon as we take the bar, which is going to have some rigidity to it, and we get into our front rack position, if we're not able to not guillotine ourselves with the bar, we are going to have a harder time loading it or adding weight and then starting to push overhead or coming into other positions. If you had difficulty with any of the first 4 pieces of front rack positioning, like your external rotation, your lats, your thoracic extension, or your wrist mobility, we do have videos that are going to speak to all 4 of those pieces individually. But if you're still feeling lack of motor control, then it might be time to see somebody about it.